Hi, my name is Joyce Artea, and I'm going to tell you about risk of pediatric celiac disease according to HLA, haplotypes, and country. Definitions. Celiac disease is an immune system condition in which people cannot consume gluten because it damages their small intestine. Gluten is a protein present in wheat, barley, and rye. It can also be found in vitamins, supplements, hair and skin products, toothpaste, and lip balms.
Celiac disease is currently understood as an immune system mediated disorder where the gluten in food triggers the body's immune cells to attack the cells in the small intestine. Gluten is found in all sorts of wheats and grains, including rye and barley. If we take a look at wheat, you've got your individual wheat kernels, and then inside each kernel there's this endosperm, which has a bunch of nutrients for the seed's embryo, mostly protein and starch, and some vitamins. The type of protein here is gluten, which is the main culprit in celiac disease. Well, really the main culprit behind celiac disease is a 33 amino acid peptide component of gluten called gliadin.
Sign up for a free trial today and watch the full video on osmosis.org.
Applications in medicines. Patients with celiac disease or type 1 diabetes usually carry at least one copy of the HLA. They are 3 DQ2.5 haplotype present in more than 90% of patients with celiac disease. The rest of the patients with this disease carry the HLA. They are 4DQ8 haplotypes. The risk of celiac disease differs between these two haplotypes, with the presence of R3DQ2 having a higher rise.
Hi, I'm Dr. Abby Hanna.
I'm Dr. Jami. We are pediatric gastroenterologists from Stanford Children's Health in Los Gatos.
We're going to discuss how to properly diagnose celiac disease for your child. Recently, there's more awareness of celiac disease in the United States because studies showed there's higher incidence than expected.
Well, celiac could present with typical GI symptoms such as chronic diarrhea, abdominal bloating, and poor weight gain. It can also present as subtle GI symptoms such as constipation, or it could present without any GI symptoms such as chronic rash, osteoporosis, and short stature. And celiac is associated with certain autoimmune disorders like thyroid disease and insulin-dependent diabetes.
In order to make a definitive diagnosis of celiac disease, we need a positive celiac markers antibodies and an intestinal biopsy by endoscopy while your child is not on gluten-free diet. If your child already on gluten-free diet, the diagnosis of celiac becomes less reliable. Also, if your child's symptoms improve on gluten-free diet, that does not always mean celiac disease.
Well, therefore, it's important to confirm the diagnosis before placing a child on lifelong gluten-free diet. Also, patients with celiac disease require periodic monitoring for nutritional deficiencies and also associated autoimmune disorders. So if you have any questions, concerns, for more information, please contact your local pediatric gastroenterologist. Thank you.
Pros and cons. Pros. It is less common in children with a single they are 3DQ2 haplotypes. Cons. The risk among Swedish children was almost twice that among children in the USA. The age at which gluten is introduced into diet affects the risk of autoimmunity to celiac disease in children with genetic predispositions. There are three. The Q2 homozygosity is associated with an early age to onset of autoimmunity in celiac disease.
Hi, my name is Dr. Naseem Kabari. I'm the director of the celiac disease program at Stanford Children's Health. Our celiac disease program provides patients and their families with a full spectrum of expert care and education around symptoms, diagnosis, and treatment of this lifelong disease. It also includes other related disorders such as non-celiac gluten sensitivity as well as gluten intolerance. Celiac disease is the most commonly inherited autoimmune disorder. It affects as many as 3 million Americans and as many as almost 1% of the general population in the United States, making it far more common than other diseases that patients may be more familiar with, such as Crohn's disease, ulcerative colitis, type 1 diabetes, and cystic fibrosis. Symptoms of celiac disease can include weight or growth problems, diarrhea, constipation, stomach pain, or rashes, but also many people may not demonstrate any symptoms, which can make the diagnosis even more difficult. Initial diagnosis begins with blood testing, followed by confirmatory endoscopy with intestinal biopsy. If you think that your child might have celiac disease, it's really important that you continue them on gluten until diagnosis is confirmed. Not doing so may actually make the diagnosis even more difficult. For more information or to make an appointment for your child, please feel free to contact us at Stanford Children's Health Celiac Disease Program.
From NIH Medline Plus magazine. Gluten. It's all over the news. But what is it, and where can it be found? Gluten is a protein. It is found naturally in some grains, such as wheat, barley, and rye. Nope, not you, rice. Common food products that have gluten include pastas, cereal, and bread. Sometimes gluten can also sneak its way into products like vitamins and supplements, lip balms, and some hair and skin products. Shh. Most people don't have a problem with gluten, but some people can't eat it because of an autoimmune disorder called celiac disease. The gluten makes them feel sick. Celiac disease sometimes is hereditary, meaning it runs in families. It's also very common. As many as 1 out of every 141 people in the United States has celiac disease. But most people who have celiac disease don't even know they have it. In celiac disease, gluten can trigger the immune system to attack the small intestine. Immune cells damage small, finger-like growths in the small intestine called villi, and the brushy intestinal lining becomes flattened. When the villi are damaged, the body can't get the nutrients it needs. The immune system's reaction can lead to other health problems as well. Symptoms of celiac disease in adults may include headaches, depression or anxiety, tiredness, bone or joint pain, and a very itchy skin rash with blisters called dermatitis herpetiformis. And in children, stomach pain, nausea and vomiting, slowed growth, and delayed puberty. If untreated, celiac disease can lead to serious complications like anemia, infertility, and weak and brittle bones. Celiac disease can be difficult to diagnose because it looks like many other diseases. If your doctor thinks you might have celiac disease, you may need a blood test looking for antibody markers like TTGA and EMA. The diagnosis can also be confirmed with a biopsy. A tiny tissue sample is obtained under anesthesia using a thin tube called an endoscope. The good news is there's a treatment, following a gluten-free diet. Patients need to learn what to eat and what to avoid, and to read nutrition labels carefully. For most people, following this diet will fix the symptoms and heal damage to the small intestine.
Issue applied in Ecuador. In Ecuador, there is no registry. Patients with celiac disease or type 1 diabetes usually carry less one copy of the HLA, DR3, DQ2.5 haplotype present in more than 90% of patients with celiac disease. Conclude.
Celiac disease is an autoimmune disorder that occurs in genetically predisposed people, and these people have a damage to the small intestine upon the ingestion of gluten. Gluten is a protein found in wheat, barley, and rye, And upon ingestion of gluten, these patients actually have damage to the small intestinal villi, or tiny finger-like projections in the small intestine that help with the absorption of nutrients. Celiac disease is a hereditary condition, meaning that it does run in families, and it's known that for a person who has a first-degree relative who has celiac disease, that patient or person has a 1 in 10 chance of developing celiac. The diagnosis of celiac disease can be quite difficult because some patients may have zero symptoms and some patients may be very symptomatic. So initially, the workup entails a blood test or a screening blood test where we check for the elevated antibody levels to gluten in the person's blood. Should we find elevated levels of those antibodies, we then proceed to a confirmatory test, which is an upper endoscopy, an outpatient procedure where we take small pieces of tissue from the small intestine to confirm the diagnosis. There currently, unfortunately, is no cure for celiac disease, but the current treatment is a lifelong gluten-free diet, which is actually the same in the pediatric and the adult population. And anytime we place a patient on such a restrictive diet, we encourage them to have close follow-up with a nutritionist to ensure that they're not at risk for certain nutritional deficiencies, such as vitamin or mineral deficiencies.
The challenges with working with children and dietary modifications is that some of these kids are picky eaters and they're not always going to want to take out their most favorite foods and replace it with something that I tell them to, and that's okay. So our initial plan might not always work, but we will edit and make it work and meet somewhere in the middle.
What sets the CADC apart in the treatment of pediatric celiac disease is our multidisciplinary team approach. So we have everyone from your gastroenterologist, who will help make the diagnosis and continue to monitor your antibody levels, our nutritionist, who comes in to see you each visit and who will monitor your gluten-free diet, our patient navigator, who helps to streamline all of your medical care and also can be helpful in terms of providing notes for school and ensuring that your child has all the care that he or she needs.
Conclusions. Children with the HLA-DR3 DQ2 haplotype, especially homozygous ones, have a high risk of autoimmunity and celiac disease in early childhood, being more frequent in Sweden. Thank you very much.